Joe Valenzuela here with Vista Mutual Insurance Services. Let's talk about agents. Not all agents are created equal. There are different types of agents. The two main types or different type of agents are captive and independent. Now, there are lots of variations in between these, and we're going to talk about those too. But let's talk about the difference between captive and independent first. Captive agents typically, kind of like the name implies, are with one company. So let's just talk about some of the big national companies like Humana, United Healthcare. These will have captive agents, meaning they are employed by the company and they only sell one product. So they're really, really well versed in that one product and they know it really well. And there are some benefits to that, but they don't offer the other products. So if you want to talk about another product other than the one that they offer, you have to go find another agent to do that for or to do that with. So that can be a little daunting, having to go to multiple agents that are captive to have them only sell one product to you. But sometimes they know the tiny little intricacies a small bit better than an agent that's not out there doing their due diligence as an independent agent. So independent agents. Independent agents are, as the name implies as well, independent. They do not work or represent just one company. So what they do is they go off on their own, and usually this involves them getting a contract through an upline, a field marketing organization, or an agency that can provide them with a contract to sell the insurance. So different agencies will contract with different carriers, and not all of them will have all carriers as well. So it does depend on who the agent's upline agency is and what contracts they have to what they can get. Now, some agents that are independent will offer every product because their agency or FMO offers those products, or because they've got multiple agencies or FMOs that they've gotten their contracts through in order to provide their clients with everything that's available in the area. There are also some instances where plans just don't offer to sell through brokers. In Northern California, Kaiser is a major carrier, and they only sell through their own captive agents. They don't offer contracts to independent brokers. So there's that as well. So in between these, there's different ways that these work together or kind of have subdivisions inside of them. So you can be a captive agent and work in a call center. Again, with the national carriers like Humana or United Healthcare, they have these huge call centers, and these are all captive agents. They only sell their product. Now, you could also be an independent agent and work in a call center like eHealth or GoHealth. These represent multiple products, but still a call center environment where they run ads, they get people to call in, and then they talk about their insurance with them. Now, with a captive call center, it's usually going to be national. It's not going to be agents that are right located in your state. So they could have a lot to understand and know, and that can lead to inaccuracies. With a independent call center, just expand that by 100, because not only are they representing just one product, now they're representing multiple products in every county that they're offering things in. So these big national call centers, what you usually get is a person just reading off of their system exactly, because they can read a plan benefits and they're certified. They can see exactly what's happening and kind of break it down for you, show you the differences, and see if it works for you. Now, that's usually, though, where their job is going to stop. Either if you're with a captive call center agent or an independent call center agent, there's not going to be a lot of after service from that particular individual. And that's the main difference, I think, too, between a call center and a field or online agent, is that we're going to provide you with that after care. So it's kind of weird if you're selling something, and I'm saying this because I used to be a call center representative a long, long time ago. So never having to talk to that customer again can lead to things of misunderstandings where you don't understand a benefit correctly and you're selling based on that. And you could do it for a whole season, and then customer service then sends you something back saying, hey, I think we're explaining this benefit incorrectly. That happens a lot less with an independent agent that's at the local level, right? They're not sitting there reading off a thing. They usually are selling these plans on a day-to-day basis, and they have a lot of knowledge on the intricacies on the plans available in their very small area. So they're also going to service you, right? So they have to make sure that what they're saying is in fact 100% true, because you're the one that's going to call them, not their customer service department or the company. You're going to call the agent that sold you the plan a month later and say, hey, this thing that you told me is not true, or it was misunderstood by me, or you misrepresented it. So we have to be very careful and educate ourselves incredibly specifically and intricately on the workings of these plans so that we don't make a mistake, because we are the person that not only sells you the plan, but services you afterwards. So that leads me to this next person, a field agent. This is what our agents are, and they work in a very small area, okay? They're not buying leads or buying calls or doing things in a large state or in multiple states. They're usually in 2 to 3 counties, and that's it. It's an area where they can get to you in the field, meaning they can go face-to-face, or you can come into their office. They're going to sit down with you, explain things in an easy-to-digest manner, and they're going to go over everything that they know from the local level, which, as you know, if you're somebody that's working and living in the area and utilizing the same services as your clients use, you're just going to know a lot more about them. You also may have contacts with the local networks and IPAs. So an IPA is an independent physician association. A network is just a group of doctors. And you're probably going to have some contacts with them if you've been in the industry as long as we have, or if you're just in it and in the field all the time. You're going to meet these people, which means that when your clients have an issue or concern, you can go to these people and ask them for help. And usually they're very willing to help you and partner with you to do things. So there's the difference, right? You have your call centers that are captive and that are independent, and that's how they're going to treat you. And then you have your field agents that are also captive and independent. They can be either, and they're going to know the local area very well. So it's up to you on what you pick on how you get your information, and you don't even need to use an agent at all if you don't want to. You could just go onto Medicare.gov or go onto each individual company's website, look at the plans and compare them yourselves. But we don't cost you anything, so no matter what you're doing, you should probably seek the advice of one of these types of agents, because they have to get certified, they have to be licensed, they have to be tested constantly to make sure that their knowledge is up to date and they know what they're talking about. So they live and breathe this stuff every single day so that you don't have to be an expert on it. It would be like trying to work on your car yourself if you've never had before. Sure, you can probably get it done. Watch some tutorials, look at a couple websites, get some parts and figure it out. But it's not going to be as good as if an expert did it for you, an expert mechanic. And if that expert mechanic didn't charge you anything to do it, you probably should use the expert. So that's just a little bit of the differences on types of agents that are out there. I also wanted to talk about, because there's kind of a hybrid between the call center field and the national call center, there's these little kind of what we call online brokers. And what they do is the majority of their business online, but they still do it in a local area so they can be very well versed in all the plans that are available there. So an online agent, and we have a few at our agency too, that don't go out into the field that much. Sometimes they will if it's necessary, but they do most of their things via Zoom or via phone. And so there's a lot of the hybrid agents out there that want to do both. We want to be able to meet our customers where they want to be met. And some people are just online people. They just want to deal with on the phone, so we'll just do that. But we then still have the local knowledge because we're right here with you. And if you ever wanted to come into our office, 2-3 years down the line to compare your options or meet your agent, it's something that you can do. I know that I just given you a lot of information and it kind of flows into itself and each other, but know that we at Vista Mutual Insurance Services are local, independent brokers that represent almost every product that we can possibly represent in the county. So we live in your area, we work in your area, we utilize the same services in most instances, so we are very knowledgeable about how healthcare works in your area, because healthcare is very local. It works differently in this county than it does in another county, and definitely differently in this state than it does in another state, or differently in Northern California than it does in Southern California. So the more local you can get with the knowledge that you have, or the person that you're seeking that knowledge from, I think the better results that you're going to get with the questions that you have. And also, the better results you're going to get when you have aftercare, if you have something that happens in the future. Because things change too, right? Each year, these plans can go up, they can go down, they can completely back out of the county, they can switch doctors' networks. So we stay up to date with all this stuff so that you don't have to do that. And if you have a call center agent, let's say, either independent or captive, that person you're probably not going to talk to ever again because of the amount of turnover at those places and just the way the business model works. You would just talk to customer service. So they're not going to actively or proactively reach out to you if they see a change that may affect you. They may just want to keep you on their books. Brings me to another point too, that a lot of agencies and agents, they're running their own business. So it's not like they all give us a handbook and say, this is what it means to be an agent. Carriers have this, and it's really kind of a suggestion of how an agent should interact. But there's nothing that really says that I have to provide you with customer service. It's something that we do because we find that it helps our customers stay with us, and that it's the right thing to do for us to gain the knowledge of how the plan works better. Some agents will just think it's their job to enroll you, and that's it. Okay, I've enrolled you. Have a great day. And because of the amount of turnover at the call center with agents and with people, it's very hard for them to be able to allow you to talk to the same person again. So for instance, if you're with me, an independent agent that's local, that's in your area, and I see that your plan is going to be going away next year, or it's going to be losing a doctor's network, I'm going to reach out to you and say, hey, we need to sit down again because we have some information that you're going to be disrupted in some way, and we'd like to help you. Whereas a call center may not, or a captive agent may not, because they don't really have something else to offer you. They would like you to stay with where you are. So not all agents are created equal, and you can choose which type of agent that you would like to use. Thanks so much. Follow us for more information. We love to bring you everything that you need to make a simple and easy decision about your Medicare insurance. So thank you so much. Follow us for more.